barriers that our community, our families continue to deal with as it relates to the social determinants of health, including housing and education and employment, and narrowing it down to transportation. But for right now, it starts with getting tested to know how many of our families have been impacted. You know, our churches are thinking of reopening, and school is about to start, and safety is very, very critical. This virus is real, and we need to dispel rumors such as Black people cannot get it, the hot weather will kill it, and it's only impacting old people. I take exception to that. Dr. Poore, of course, will address this factual statistic later. But thanks to the state of Nebraska and Danette Smith, drive-up testing will occur today from 10 a.m. to 2 p.m. at Jackson Tower, that's 600 South 27th Street. And then again, right here at Salem Baptist Church on Saturday, July 11th, from 10 a.m. to 2 p.m. And Salem here is located at 3131 Lake Street. No appointment is necessary. And if you are a resident of OHA and do not have transportation, Sally Saka of Omaha Housing Authority has a solution for you, and he'll be coming up to discuss. And we thank Sal of the Housing Authority and Danette Smith of the Nebraska Department of Health and Human Services. She's the president and CEO. Dr. Poore and Kenny McMorris of Charles Drew for partnering with us on this initiative. While we may serve in different lanes, we are still on the same highway for a healthy future, and we look forward to working with each of you on this critical endeavor. Now I'll ask Ms. Smith to come up and share some state information with us, and following her will be Dr. Poore with local information, and Mr. Kenny McMorris, followed by Sally Saka and Eric Bergen, a resident board member with OHA, and Reverend Dwayne Hawkins, who's president of our New Era Baptist State Convention. Thank you, Danette. Thank you.
Good morning to everyone, and it is such a pleasure to be here at Salem Baptist Church. I want to first thank Ms. Lester and also all of the community partners who are working with us this morning on this event. Reverend Hawkins, I had the opportunity to finally meet him. Dr. Poore, haven't had the opportunity, but look forward to chatting with you this morning. Certainly Sal, my brother from Chicago, didn't know we had that in common. And most importantly, Kenny McMorris from Charles Drew. Thank you so much for being here and being willing to partner with us. The state is excited to be able to participate in this. It allows the state to come from Lincoln, Nebraska, right down to the hood and to the community, and that's where we should be. We are thrilled to be participating with these community partners on making sure that people of color, African Americans, people who look like me are getting tested, because it is absolutely important. The ability to collaborate, the ability to have good services in our community, to be able to call on our FQHCs, our public health entities, to be able to ensure that testing is being provided in a timely manner in our community is also is very important. I think about my own personal experience. COVID has hit my personal family twice. And because of that, this is more than just getting a test. It's really about saving my family. It's really about saving my community and making sure that everybody in my community understands their well-being and their physical health, for which some of our folklore doesn't allow us to be open to really being transparent about how well we take care of ourselves. This testing event is more than just a testing event. It's really about African Americans understanding their physical well-being and how important that is. from 30 years old all the way up to 80. We hope that you will come out in droves, that you will show up at our testing sites with Omaha Public Housing and also here at Salem Baptist. Because I can tell you from personal experience in the 2 incidences I've had in my family, it could have been death. It's really that simple. It could have been death. I want to share with you just a little bit of the state data. I know that Dr. Poore is going to talk a lot about what's going on here in Douglas County, but I want to implore upon you that to live in our folklore of not getting tested, not getting the vaccine, it's life-threatening not to get the care and to not understand your health status. So here in Nebraska, today our state has tested approximately 20,000 individuals, 20,623 positive COVID-19 cases. Of those positive cases, we have data on race and ethnicity for approximately 15,971 individuals. Let me break that down a little bit. 42% identify as Hispanic or Latino, 8% identify as other race or multicultural or multiracial, 6% identify as Asian, and 6% identify as African American, with 1% identifying as American Indian or Alaskan Native. When we look at the COVID cases and how it splits those cases that are positive, in the state that we see almost a clear split that there are, in that split of COVID-19, 51% represent females and 49% represent males. 66% of the positive cases are among 3 age groups. And I really want everybody to hear this, because most of us have been thinking that it's in the category of 50 and above. That's not true. I can tell you in my personal experience, it was not somebody in my family that was 50 and above. So here's where the age range lies: 20 to 34, 35 to 44, and finally 45 to 54. Each group makes up about 18% of all of the positive cases here in Nebraska. Let's talk a little bit about hospitalizations across the state. And many of you know that the governor continues to report that we're in pretty good shape with our hospital beds, with our ventilator beds, with our ventilators rather, and our ICU beds. Among those patients hospitalized, overwhelmingly the majority right now is 75% of people who are 50 years or older. But I'm going to say to you that in my family experience and the people who were in the hospital with my family member, most of them range between the ages of 30 and 45. So it's no longer just people who we consider older. Of COVID-19 related deaths, over 80% among those deaths are 60 years and older. We have in the state a total death rate of 284 persons. When we talk about hospitalizations, 68% who present to the hospital are Caucasian, 41% are Hispanic or Latino, with 8% being African American, 8% representing multiracial or other races, 7% being Asian, and 2% being American Indian and Alaskan Native. When we look at the deaths still remain 76% with the Caucasian population. However, what's very startling is that 23% across the state have been Hispanic or Latino, with 8% around African Americans. I want to speak just real briefly about the African American piece, because sometimes it's about access and some of it's about fear. We show up in the emergency room when we're on the way to ICU and on the way to really needing oxygen. We've got to get there sooner. That's why testing is so important. We can't wait till the last minute to get to the emergency room saying we got the flu, because by the time we get there, we're past the flu. African Americans make up 5% of the population here in Nebraska. However, we've accounted for 8% of COVID-19 deaths. Hispanics make up 11% of the population here in the state, and they have accounted for 23% of the deaths. Additionally, Hispanics make up 11% of the population, and they have represented 41% with COVID hospitalizations. Those who identify as Asians finally make up 2% of Nebraska's population, and they have represented 7% of COVID hospitalizations. I bring this to your attention because this is nothing that we can negotiate with anymore. We can't negotiate with taking the flu vaccine that'll be coming out this fall. We won't be able to negotiate about taking the vaccine when it comes out later this year for COVID-19. I can't express to you, as one of your state leaders, how important it's going to be for us to take care of our health and understand our well-being. This is why it is so important that we're working here in Douglas County with Dr. Poore and the Douglas County Public Health Department, and certainly with Kenny McMorris over at Charles Drew, because it's life-threatening at this point. You got to get tested so that you understand your health well-being. With that, I'd like to turn it over to Dr. Poore for some local remarks. Thank you so much.
So good morning, everyone, and thanks for having me here and inviting me to this group. You know, this is my community, and I feel very proud of being here and really sharing with you today what does our community look like? What does Douglas County look like? You heard from Danette Smith, oh my God, I cannot even talk, statistics about what the state looks like. We are pretty much the same, but there are some striking differences in our community. So let me just share with you a few data points. Today, we have 7,862 cases in Douglas County, and we have tested 68,428. Potentially 12% of our community has been tested. That's actually a pretty good number, wouldn't you say so? 12%, that's pretty good, but we need to do better. We need to do better because only by testing, and I'm telling you why, because there is so many times that we now have asymptomatic individuals who are only through circumstances, for example, they have to go to the dentist or they have surgery. So the physicians are requiring, you need to get a test. They have no symptoms, they take the test, and what happens? They are positive. So we do not know if we are positive, if we are pre-symptomatic or asymptomatic, if we are not going to get tested. And every time we do not know this, we are exposing our friends, our families to potential COVID-19. So let's keep that in mind. Last week and the weeks before, we had pretty good weeks, because our case numbers decreased and our positivity rate at the same time decreased. That's important, really, both of them decreasing. So we had a positivity rate of 7.8% last week. That was the lowest since May 1st. However, you know, I'm looking at the data every day when it comes in. As a matter of fact, I was sitting out here in the parking lot when I arrived, and our epidemiologists were just presenting to me the data that came in from last night. We have, again, 100 individuals that have tested positive, and the results were reported to us yesterday. So what we are seeing this week, and I'm very concerned about, we are seeing an increase in positivity rate, up to 10%. I'm looking at it very carefully to see what age group, how did this happen. We are talking to the Chief Medical Officer, Dr. Antone, actually already this morning, and saying, could it be that there is some testing going on in long-term care facilities? Could that actually bring the numbers up? I don't see it. I don't see it at that time. So when we look at race and ethnicity in Douglas County, let me share with you a little bit. Asian population has been at 13% for many, many weeks. Of course, the population only makes up 4% in our community, so you can imagine that is a disparity. African Americans make up 9%. It has always been 8%, 9%. You may want to say, well, what is 9%? That's really a low percentage, isn't it? But let me share with you how many people that is. That is 673 African Americans who have been diagnosed with COVID-19 in our community right here. That is too many in my mind. But what we have seen, where we have seen the biggest fluctuation has been in our Hispanic population. There used to be weeks where I would say 54% of our cases are in our Hispanic population, and that has dropped, fortunately for that population. It has dropped actually to 48%. So which age group has increased, would you say? Well, it is the white Caucasians. We have seen that percentage increase. It used to be 19% for many weeks, and it is now up to 26%. So I think we need to be very careful and look at the data very closely so that we can make right policy decisions like you are doing today, saying we need to bring more opportunity of testing and hopefully encourage more people to get tested. Where do we see the biggest changes in regards to positivity rate, in regards to age groups? When we are looking at the 0 to 34-year-old, that is the age range where we see the highest number of cases. 56% of our cases are in that age group, and that age group has increased. It used to be 46%, it has increased up now to 54%. Exposure is an interesting question too. Where are these people potentially exposed? And it's about half and half. Half of them are saying, I have no idea where we have been exposed. It's in the community. So those are the instances that I'm very concerned about. The other half says, we have been in contact with an individual who has been positive. We probably have not taken it serious. So that's another message we really need to get out there. If you have a household member that has been positive, you know somebody at work that you have been around and close exposure. And let me just talk about what we talk about close exposure. Close exposure is closer than 6 feet for 15 minutes. That is a high-risk exposure. Specifically, if you are not wearing masks, and you are in contact with that individual closer than 6 feet for longer than 15 minutes. It's not just walking by somebody. It really needs to be a longer-term exposure. Hospital utilization, you heard about it from Danette Smith. It actually is a good story. It is a good story for our hospitals in Douglas County as well, because we have seen constant decreases. When I look at the COVID patients that are in Douglas County hospitals, there are, as of yesterday, 77 patients that are COVID patients in our hospital. That used to be, the high used to be 163. So from 163, we have come down, consistently down to 77. I'm also interested to see, we have lots of ventilators in our hospital, and we are very safe about that. I'm not concerned about that. But I'm always concerned how many COVID patients are on ventilators, because we know once you are on a ventilator, the risk for getting off and really being able to go home again is less. So when we are looking at how many COVID patients, we have 14 COVID patients as of yesterday that are on a ventilator. And you are saying, well, what does that compare to? There used to be at our high, we were at 49. We had 49 COVID patients who were on ventilators. We have now 14. In total, how many ventilators do we have in our community? 363. So you can see the supply of ventilator is really splendid in this community. We are recovering patients all the time, and you may ask, what does it mean being recovered? It means that one of our staff is calling up the individual and are saying, tell me about your symptoms. Have your symptoms, are they gone completely? Or are you still having lingering symptoms? And it's only when they say, no, our symptoms are completely gone, are then being counted as a recovered individual. 54% of our cases are recovered at this time. I also looked up something this morning, why it is so important for this community to be tested. We talk about underlying illnesses. And, you know, we always talk about the health disparities that our African American and also some of our other minorities are experiencing. But I needed to remind myself again, when we look at cardiovascular disease, African Americans are 1.5 times at a higher rate than our white population. When we look at diabetes, I thought that was very interesting too. 16% of our African American are saying they have been diagnosed with diabetes. How much is it in the Hispanic population? How much is it in the white population? 9 and 10%. But 16% in the African American population. We know that diabetes is an underlying morbidity that we see with patients. I look at every single death certificate that comes through, and many, many times diabetes is on that death certificate. So let me talk a little bit about something that we really don't like to talk about, that is death. And I said to somebody yesterday, I still remember the first death. It was on 3/27. It was like a family member of mine. I knew the entire history, where that person was, how they got infected, and how they actually died. They died in their home, which I will never forget, because how tragic must that be without any of your family around you. But since the 27th of March, we have had 102 individuals who died where COVID was one of the responsibility of their death. It may not be only COVID, it may be also comorbidity. And most of these individuals actually had comorbidities, had underlying diseases. Only 9% of those 102 did not have any underlying illnesses. When we look at that, of course, 73% of those individuals who died were above 65 years of age. And when we break it down by race and ethnicity, 62 of them are of the white population. Quite different a little bit than what Danette Smith was telling you about the state. 15% of our deaths are in our African Americans. So you can calculate yourself, we had 102 deaths, 15%, that's potentially 15 cases of African American who died where one of the causes of death was COVID-19. We have 19% of Hispanic and 4% of Asian population. We also are talking about clusters. Where are these cases coming from? And we have at this time 315 clusters in our community. That means when we do contact tracing and we ask the individuals, potentially, where have you been exposed? They are telling us, you know, we are working in this business and there are more than 2 people that potentially work there and have also been infected. From the 315 clusters, we see that 47 clusters are in the construction industry. That means small businesses, that could be a painter, could be electrician, small construction companies, but they had more than 2 individuals who were positive with COVID-19. The second group are our long-term care facilities. We have 35 long-term care facilities who had more than 1 case, and 55 deaths in long-term care facilities, and that is tragic, and I think we hear the same stories nationwide. Meatpacking actually are the clusters, meatpacking or food processing, both of them are being put together. We have 29 clusters in that category, but they make up the biggest number of cases. They actually have 1,370 cases in that industry. And of course, many of you have heard that's also where some of our minority community works and therefore has had an inappropriate burden. I want to share with you something that we just started yesterday, and I'm putting this up so you can see it. It's a dial, a risk dial that we are starting to have on our website. The risk dial actually tells you 8 parameters, 8 measures go into the risk dial, and it tells you very quickly, overall, where are we standing at this time? And it is made so the public can look at this and say, are we in the green or are we in the severe zone? There are 4 different colors. Green, of course, is low risk. Moderate would be yellow, and high would be orange, and red is severe. We are now in the moderate, meaning we are not high, we are not green, we really need to be cautious. To share with you a little bit, just if you are interested, and we'll also have it on our website, to tell you the measures that are going into that. It's the positivity rate, it's the change of cases that we have from week to week, increases or decreases. It's the number of COVID patients that we have. How does that change from week to week? It's the number of COVID patients with ventilators every week. It's also testing availability, and because we do think, if you are in a position as I am, as the net is, we need to look at what is the availability of testing. Is it widely available for everyone in our community, or is it only available to some? Do we have an issue with the supply chain, or is it very limited? Is the criteria very tight? And I would remember back in March, the criteria was very tight. You needed to be a healthcare worker or first responders or symptoms, and only then could you get tested. So that is being put into the dial too. And the last thing is that the governor is always expressing, and we all know how important it is contact tracing. How quickly can we do contact tracing once we get the results from the laboratories? And the measure we are using is the percentage of contact tracing that we can do within the first 24 hours, because that is very important. So all these measures are going into the dial, and we adjust the dial once a week on a Monday morning, because our week, according to CDC, ends on Saturday at midnight. So anybody who is interested can look at that. So let me just close with talking to you about some other testing opportunities. I love this testing collaboration that is going on the next 2 days up here at the church, at OHA, and so on. But let's also talk about some of the other opportunities that we have, so that nobody should use it as an excuse they are not being able to get tested because there are not enough opportunities. There are. So there is the Test Nebraska, which is the initiative that the governor initiated, free of charge for everybody, no insurance necessary. So Test Nebraska at this time is at Crossroads, where the old Sears stores used to be. You have to go on the website and actually sign up and register. And there are a few questions. There's a little bit an assessment component in there. And then you can choose when you want to go and where you want to go to get tested. We are looking at this time for a second big site for Test Nebraska, because potentially we'll have Test Nebraska here, potentially through October. I tell you what is the benefit of Test Nebraska is it's the fast turnaround. There are studies analysis that have been done. The governor was just sharing with me yesterday. The turnaround time is 24 hours. That is enormous. That is so important, because if you have a longer turnaround time, you actually are waiting for the results to come back. So either you are isolating at home, or you may actually expose others before you get the results back. And think about how you would feel about this. For example, being here right now, having had a test yesterday or the day before, but don't know the results yet. I'm coming out here, I get the results tonight, and they are saying it's positive. I need to go through my head and say, have I exposed somebody in this group? I tell you, from my experience, I had a test done because I did some travel and came home and had a cough, and this was at the beginning of it. And I was supposed to have a conference, a news conference with the mayor. I had gone in for the test, and I had hoped I would have the test results back before I had the news conference with her. If the test results didn't come back, I didn't go to the news conference. I stayed home. I thought, I need to be the example. How bad would I feel if potentially I could have exposed people at that news conference? The other thing, the last thing I just want you to know is, I think nowadays that the virus is in this community. We really need to think about everybody can be infected. And how important is it to wear masks? I had a quick discussion with Kenny McMorris before, and I can tell you how happy I am to hear from him. He is saying, driving around here in North Omaha, he's seeing more and more people wearing masks. That's what I would like to hear. So, not one of from your community told me the other day that he was handing out masks, and the person he handed out the mask to said, why are you handing me out masks? I thought this was gone a long time ago. So this tells you again how we need to reinforce everything. So with that being said, thanks for having me here. Kenny, please come up. I am so proud to have you as a partner, to be the healthcare provider for this community and be a trusted source for this community. Thank you.
Thank you. Well, good morning, everyone. This is truly an amazing day. I think about being a native of Omaha, growing up in this community. Literally, I grew up in the Hilltop Projects right there. My apartment unit was right there. And so for the greater part of my life, growing up in this community, understanding how to navigate this community, and really recognizing the resiliency that when you are from this community, built in this community, and by this community, when you come into times like this, it really shows. And so I do want to commend Ms. Lassiter, obviously Reverend Hawkins, Ms. Smith, as well as Dr. Poore and Mr. Osaka, and all of those that are really looking at how can we make sure that this community gets access to the resources and support needed to address this pandemic. There's been a lot of misinformation out there, a lot of things that are going on as it relates to how people can be impacted by this virus. But for those that have been doing this work, people that have been in community health and public health, know that a lot of this really stems from the social determinants of health. And so I'm here today as the Chief Executive Officer for Charles Drew Health Center. And a little bit about our health center is that we are a community-based, patient-directed company that delivers comprehensive, culturally sensitive, high-quality primary health care. Our healthcare model includes integrated access to medical, dental, behavioral health, including substance use disorder support, pharmacy, and wellness services in communities where economic or cultural barriers limit access to affordable health care. In 2019, we served nearly 16,000 patients, accounting for 47,000 encounters across 13 service locations within North Omaha. 47% of our health center patients are uninsured. 79% are 100% or below the federal poverty level. That's roughly about $26,000 a year for a family of four. The COVID-19 pandemic and the recent social unrest has laid to bear the stark structural and systemic racial inequalities that have impacted our health and well-being within this particular community. While these events have shined a light on gaps in health equity for the media and the broader public, they're nothing new. These issues are symptoms of a broader economic and social challenge that is rooted in structural systemic barriers across sectors. Evidence and research has taught us that so much of an individual's overall health and well-being is based on their built environment. We're going to start hearing a lot more about the social determinants of health. I'll refer to them as the social drivers of health, for which is the condition in which people are born, grow, work, live, and age, and the wider set of focus and systems shaping the conditions of daily life that significantly affects an individual's ability for optimal health. Therefore, our access, our capacity, and our ability to increase access to testing is so key in responding to COVID-19. This targeted testing initiative seeks to confront historical health disparities by increasing COVID-19 testing and expanding our capacity. Charles Drew has been on the front lines of preventing the spread within our community. We are currently providing free drive-up COVID-19 diagnostic tests at our main location, which is located at 2915 Grant Street, right down the hill from here, for those who are presenting with signs or without signs and symptoms. To date, we have provided over 3,000 tests with a cumulative positivity rate of about 18.9%. I know Dr. Porter mentioned kind of where we've been going on a weekly basis as it relates to positivity. Our rate last week was 12.9%. So we've been incrementally going down. At our peak, we were at 34%. Our primary zip codes are 68111, 110, and 104. And at our peak in those zip codes, we were at 43%. So we're starting to see progress made as it relates to the positivity rate within the population. Additionally, the COVID-19 pandemic and resulting economic downturn has had a negative effect on many people's health and has created new barriers for individuals already battling mental illness and substance use disorder. A recent Kaiser Family Foundation poll found that nearly half of the adults in the United States reported that their mental health had been negatively impacted due to the worry of stress of the virus. As the pandemic wears on, it is likely that the mental health burden will increase. In closing, I would like to say that much is known or is unknown about the virus. We do have a reasonable understanding of how it spreads and what is needed to support communities. History has shown us that severe illness and mortality rates tend to be higher for racial and ethnic minorities during public health emergencies. This underscores the importance of connecting individuals with healthcare homes and working with trusted existing community partners to ensure testing and other social supports are accessible and available. Shared faith, family, and cultural institutions are common sources of social support. These institutions can empower and encourage individuals and communities to take action to prevent the spread of COVID-19, care for those who become sick, and help community members cope with stress. For over 37 years, and as Nebraska's first federally qualified health center, we have and we will continue to serve as a critical component of the broader safety net system. I commend everyone in this room today. It's good to see that we are modeling the behaviors that we want our community to live by. But we are not out of the woods yet. Former basketball player, so we really are in the first quarter of the first 5 minutes of the first quarter of this pandemic. And it's going to take all of us doing our part, being supportive, destigmatizing individuals that may contract the virus, and making sure that we're available to support them. This initiative and today allows us that platform to make sure that folks are getting tested. So again, I want to commend everyone for being here. We are going to have a long road ahead. As I said before, Charles Drew Health Center is here and we will continue to be here. We are providing testing. If individuals want more questions about the testing and the services that we're providing, they can visit us at charlesdrew.com or give us a call at 402-451-3553. Next, I'll allow it to my brother. We've been part of this fight for a long time, and leadership matters in times like this. The Omaha Housing Authority, and as a kid that grew up, has been living in the Omaha Housing Authority, the work that they do every day on the ground to make sure that people get access and support and have great living conditions is a daunting task, but they wake up every day to try to make the impossible possible. So we'd like to bring up Salu Asaka, leader with the Omaha Housing Authority.
Thank you, Kenny. Good morning, everyone. It is with extreme pleasure and humbly to stand here on behalf of the Housing Authority and our residents and our staff. First, I would like to express our gratitude to Mrs. Smith and her staff to really allow us to be part of this testing event. With no question about it, we touch almost 17,000 household members, and I'll be able to go into that a little bit. Second, I definitely want to thank Doris Lassiter to making that phone call to allow us to get involved with this, and definitely Dr. Poore and her staff. I can tell you, every day I get calls from somebody from Dr. Poore's staff, Sal, what do you need? How can we help? and it just makes us feel comfortable. And of course, my brother from Charles Drew, Kenny, we go back and forth how we can provide the adequate services for our residents. Currently, Charles Drew have 4 active clinics at the Housing Authority. Today, they still out there doing some intensive outreach to really understand what our residents need, and we really appreciate that. Also, I'd like to thank everyone who have taken the time to test it, to better understand what this virus can absolutely do. We got to figure out a way to stop the spread. Also, I'd like to thank Commissioner Chris Rogers, who always has his phone available when we call him. He always answers the phone at 12 o'clock at night when I call him and say, what do you think? How can we help our residents? And we really want to thank you for your commitment and also your dedication to our community. The Omaha Housing Authority, our mission is to provide ongoing quality and affordable housing for low-income and moderate-income families, and finding a way to remove all the necessary barriers to help them to become economic self-sufficiency by offering those additional resources such as the testing, the partners that's in here. Who are we? The Housing Authority, we are the largest landlord in the state of Nebraska. We own and operate 2,800 public housing units throughout the Douglas County. It ranges anywhere from 1 bedroom to 7 bedroom. We have family from 1 individual all the way to 16 individuals in 1 household. We also administer and subsidize 4,800 Section 8 vouchers, which equivalent to almost 12,000 household members. And again, we touch close to 17,000 individuals every day. So yes, this testing is very critical for the Housing Authority. And again, we thank everyone for their involvement. We thank you. We are encouraging our residents to come out to Jackson Tower today from 10 to 2 p.m., 600 South 27th Street. We have 3 transportation options. We're working with Simple Foundation and Lyft to actually provide transportation for anyone in the city that want to get to the site for free. The code for that is a simple test 2020. Again, a simple test 2020 to allow you, if you don't feel comfortable to drive in a van or in a bus, make that phone call, download the Lyft app to allow you to get a free transportation to and from to our site. We are, I'm sorry. Yes, it's Lyft. Actually, yes, for us new guys, there's an Uber and there's a Lyft. We're using Lyft. Lyft is another method of Uber as well. So yeah, it is. We also have the Housing Authority van. We got 4 vans that will be available to transport anyone in the city that want to come to that testing site. We also partner with our refugee partners who also they focus on the cab driving, those kinds. They volunteer to transport anyone in the city to come to those sites for free as well. We are encouraging and assisting and pleading and welcoming and inviting anyone, especially our residents, family, to come to Jackson Tower. If you can't make it to Jackson Tower today, make sure you come to Salem tomorrow to get tested. After those days, please reach out to Charles Drew. They've been here. They're always going to be here. And I can tell you, Charles Drew always been our strong partner for the Housing Authority, and we thank you for everything that you have done. What I'd like to do, we have a representative from the Housing Authority, Eric Burton, who is the president of our resident council, also a member of the Housing Authority executive body, who is appointed by the mayor and approved by the city council. So I want Eric to come out here just to say a few words to encourage our residents to come out and vote. Not to vote. We still have to vote. That's absolutely, we have to vote, but to be tested. Eric, come on up. Thank you. Eric been around the community for a long time, but he's a very advocate, a strong advocate for our residents and also for this community. Eric?
They got to excuse me, got a bad foot. But I was just actually want to say,
Speak up.
I'm here for to represent the people that I want them to come out and make sure that they get tested for this virus. I've been tested twice already because I had surgery. But my point is, it's very important for everybody. I don't care who you are, to come out in this city, come out and get tested, because I don't want to see nothing happen to my grandkids, my kids, or anybody, my neighbors, my friends, you know. And I represent a lot of residents of housing, and I want to make sure that every last one of them get tested, and even the employees. It's very important for the employees to be tested. So whatever we can do to get everybody to work together, I would appreciate it. This is just beautiful right here. All the ministries getting together, doing what they need to do. And we get more people in the community to do this, we probably can get this thing knocked out or get a better grip on it anyway. And that's what I'm saying. So at the end of the day, come out and get tested. It's free. Take advantage of the situation today. And tomorrow right here in Salem. Be here 10 to 2. I'm coming down. So come on down and enjoy. I ain't gonna say enjoy, but come on down and see, you know, have it taken care of. Thank you.
Thank you, Eric. With that said, I would like to call up Pastor Hawkins to come up. Thank you so much for allowing us to be part of this. Thank you.
Good to see everyone out this morning for such an historic event in the life of our community. To see so many agencies collaborating to benefit Omaha community. My name is Dwayne Hawkins, pastor of the Antioch Baptist Church. I also lead the New Era Baptist State Convention of Nebraska. Our mission is to encourage and equip the local church as the local church carries out its mission. One of the questions that perhaps have been asked is, why is the church engaging in the work providing COVID testing? The answer to me is simple. We have 26 churches in our state convention. All but one are in the Omaha metropolitan area. And as of to date, there's approximately 25% of those churches that have reopened their sanctuaries for worship. And so as I'm listening to Dr. Orr talk about clusters, the last thing we want is for a local church to become one of those clusters where COVID tracing can be traced to. And with 25% of our churches already open, it is imperative for us, if we're going to equip the local church, to do everything in our power to ensure that when they open, that they can open with some sense of what's going on in the populations that attend those local churches. So we're excited to do that. Just one amongst other strategies, we've been providing information to our churches. We've been providing PPE to our churches and equipping them with regard to social distancing and providing masks and touchless thermometers and gloves and all of these other types of equipment. But it was not complete without providing opportunity for individuals to come get tested. We are certainly in support of the Test Nebraska and the work that's being done in our own community with Charles Drew. So grateful that they've been doing this. But this just provides another opportunity on a Saturday morning. Perhaps that may be a little bit easier for scheduling opportunities for people to come out and to get tested. And certainly there are more churches in our community that are currently open, currently are planning to reopen in the next few weeks. We want to provide an opportunity for everybody in the community as we initially wanted to make sure that the churches were doing their part in the lowering the spread. So I'm excited about what that means for us. But the call is just greater than the church community. It's the community as a whole, particularly the African American community. We want to encourage you all. Just like Kenny, I'm born and raised in Omaha, Nebraska, and Dr. Ford talked about those 101 or so deaths that were COVID related, and about 15% of those were African American. One of those 15 was my uncle. And so I understand firsthand the impact that COVID can have upon a family, and all of the different aspects of not being able to gather and provide comfort one with another, and all of those things. So this effort to me is more than just a community effort, more than just a church effort. It's really personal. If I can help one family avoid what I experienced, all of this really will have been worth it. And so I just really want to take this opportunity to thank all of those who have come together, certainly to the state level with Jeanette. We thank you so much for your support and for your resources and guidance and providing opportunities for individuals to come out today and tomorrow. And Dr. Ford, we thank you so much for your continuing work, and we look forward to working together more closely in the future, and to our community partners, Kenny McMorris, doing wonderful work, looking forward to opportunities to continue to partner together. Sal at OHA, thank you for all that you do, and just want to say what a picture it is when the state level, when the county level, community can all come together for one reason and for one purpose, to benefit our community as a whole. It's just a wonderful thing. And so again, testing is taking place on today at Jackson Tower, 10 a.m. to 2 p.m. Testing takes place here tomorrow, parking lot, Salem Baptist Church, 10 a.m. to 2 p.m. Questions have arisen regarding pre-registration. You can pre-register if you desire, but it is not necessary. If you don't desire to pre-register, you can just simply show up and be prepared to give your name and either telephone number or email address, and that will suffice. And so we are excited about serving our community and look forward to opportunities to do it in the future. And so to all of our media, we thank you, and for all the community that are here. This actually will bring our press conference to a close, and then we'll be available afterwards if there's some who have specific questions. Thank you all for coming, and have a wonderful day.